Hello and welcome. I'm Dr. Pierre Morris, the Residency Director at the Wayne State University Ascension Providence Rochester Hospital Family Medicine Residency Program. Thank you for your interest in our program. We are located in Rochester Hills, Michigan, a beautiful city 30 miles north of Detroit with a population of 80,000. Rochester Hills is among the 50 most educated cities in the United States. In terms of trivia, the singer Madonna grew up in Rochester Hills, and rapper Eminem currently lives in Rochester Hills as well, not far from our hospital. Our residents and staff look forward to meeting you and answering any questions you may have about the program. In addition to myself, we have our Associate Program Director, Dr. Tess McCready, our Program Coordinator, Ms. Rose Michelli, and our two Chief Residents, Dr. Ashley Aragona, standing third from the left, and Dr. Ben Maynard, standing fourth from the left. Let me tell you a little bit about our hospital. Originally named Crenton Hospital Medical Center, the hospital was located in Detroit until 1967, when it was relocated to Rochester Hills. Since this time, the hospital has undergone several renovations and additions, including a name change in 2015 to Ascension Providence Rochester Hospital. In 2014, we completed construction on the South Tower, a very modern, state-of-the-art addition where our residency administrative offices are now located. We have 290 full-service beds, over 500 physicians, 54 medical specialties, and the hospital offers the full scope of inpatient, emergency, and surgical care for more than 40,000 patients a year. We have 12 ICU beds plus a cardiovascular ICU. The emergency room has 30 beds and a new senior citizens wing to address the healthcare needs of the elderly. Our hospital is the clinical site of 4 Wayne State University residency programs. They include family medicine, transitional year, preventive medicine, and internal medicine. Additionally, the Oakland University School of Nursing students also complete their clinical rotations on our Ascension Rochester campus. We have 2 family medicine residency tracks, which includes the categorical program and the urban track program. The categorical family medicine residency consists of 6 residents per class. It's a 3-year program, and it's located on the campus of Ascension Providence Rochester Hospital. The urban track program takes 3 to 4 residents per class. It's also a 3-year program, and the home hospital is on the Henry Ford Hospital Detroit campus. Our transitional year program consists of 4 residents per class and is a traditional 1-year residency program. Residents who match into the program go on to complete categorical residencies in anesthesia, ophthalmology, dermatology, physical medicine rehab, and radiation oncology. In 2019, we developed our newest residency program, the Preventive Medicine Residency. Our inaugural class matriculated on July 1st, 2020. This is a 3-year program, the first of which parallels our transitional year program. Let me give you an example of what a typical first-year schedule will look like for the internship year. You have 4 months of inpatient medicine. That's done here at our Ascension Providence Rochester Hospital. You have 2 months of OB that are also done on this location. 1 month of surgery. 1 month of inpatient pediatrics. That's downtown at Children's Hospital. Consists of 1 month. We have 1 month of outpatient peds in the Rochester area. That's an outpatient pediatrician's office. And we have 1 month of integrative family medicine rotation. That consists of a multitude of events, both in the community as well as personal assignments that are completed during the rotation. We also have 1 month of emergency medicine here at our hospital and also 1 month of elective, and that completes the first year. So how does your typical day look while on the inpatient service during your first year? It'll consist of 6 days per week total. You will have 1 and 7 days off. The day will start around 7 o'clock in the morning and will continue to about 4 p.m. for 4 days out of the week. And then for the other 2 days out of the week, you'll start at 7 o'clock in the morning and you'll end at 7 p.m. Sign out is at 6:45 in the morning. Rounds typically start at 9 and will continue to about 11. And lunch is usually around 12 o'clock. We have time set aside for teaching, and that's between 2 and 3 p.m. And then in the evening, sign out will be from 3 to 4 p.m. There will be approximately 20 patients per team, and each intern will carry a maximum of 4 to 6 patients per day. Also, during the internship, your outpatient rotations will be a 1-to-1 preceptorship with the attendings. You'll follow their office hours, and generally you'll have weekends off during these outpatient rotations. You will have dedicated time for didactics. These are scheduled every Tuesday afternoon from noon until about 4 or 5 p.m. The location is generally in our clinic or in the 2 South Conference Room in the hospital. Because of COVID, most of these meetings are now done virtually. So some examples of didactics. These include lectures that the residents provide, such as morbidity and mortality, and floor cases, where the cases are dissected using the fishbone diagram so that we can learn various aspects of the case and determine what could be done to improve outcomes for the patients that we're discussing. We also have specialist lectures. Those include cardiology lectures, orthopedic surgery lectures, rheumatology, gastroenterology, etc. And we also have a procedure lab where residents are instructed on how to perform joint injections, trigger point injections, splinting, pelvic exams, insertion of Nexpanons for birth control, etc. We also have a scholarship hour, as well as journal club and QI project planning during these didactics. We also have a board review that's given monthly, as well as step 3 preparation. We have some unique benefits that we provide for the residents as well. These consist of meal credits. Each resident gets $5.50 per day to use at the hospital at Ascension Providence Rochester. This resets daily. This meal credit can be used for breakfast, lunch, or dinner. And on the weekends, the meal credit can be used at Starbucks, since the cafeteria is generally not open on the weekends. In terms of CME, the first year residents get $1,000, the second year $1,500, and the third year residents get $2,000. Additionally, we provide $800 reimbursement for personal computers that the residents can use throughout the residency, and these computers are theirs to keep upon graduation as well. In terms of vacation, residents get a total of 20 days per year, and they can take up to 5 days maximum per month, which translates into approximately about a week or so. Resident wellness is extremely important in our program. We started a wellness curriculum 3 years ago. We sponsor wellness events, and these consist of monthly out-of-work events. And we've done things such as bowling, whirly ball, mini golf, bowling, and dinner. We've also had wellness breaks scheduled during the 5th Tuesdays of didactics. And during these periods, we will do a variety of things such as cookie decorating, we'll have ice cream parties, Easter egg hunts we've had in the past, and group games. We also have a wellness library that's located in the Family Medicine Administrative Office. And we have books that are fiction, nonfiction, self-help books, books on cooking, exercise, parenting, etc. that are freely available to all residents if needed. These are some pictures of some of our wellness events. As you see, we love having fun with the faculty, with our staff, with our medical assistants, as well as the residents. We've had lots of outdoor activities for our wellness, and because of COVID, nearly all of our activities are now outdoors with proper social distancing. Community service is extremely important to our residency program. Each year we participate in a variety of activities in the community. These consist of, for example, the Rochester Farmers Market every summer, the Michigan Senior Olympics both during the winter and summer months when they're scheduled, and Neighborhood House, which is a community outreach house that provides education and resources to the community. High school and college sports physicals, we participate every year, and we donate about $20,000 of our service back to the high school, where they've used that money to purchase needed equipment. We also participate in the Robert R. Frank Student-Run Free Clinic. All of our faculty rotate through that clinic, which is located in Detroit, and this clinic provides free medical care to the uninsured population of Detroit. We also provide medical education and resources to the Older Persons Commission, OPC, which is a senior citizens center in Rochester, and we provide education and roundtable discussions covering a variety of topics such as hypertension, diabetes, and other topics that we've been invited to discuss. All of our residents are employed 100% by Wayne State University, and as a result, our residents are entitled to all the benefits that Wayne State offers, and these include health insurance as well as dental insurance, and the 403B retirement plans with matching funds. All of our residents have access to the Wayne State University School of Medicine library called the Schiffman Medical Library. All of our residents have access to the Wayne State gyms and discounts with the Wayne State One card. We also have an on-site gym on our hospital campus at Ascension Providence Rochester Hospital. And the medical school also provides life insurance and disability insurance. We also offer scholarship mentoring as well for every resident so that your projects have the full scope of resources needed to be successful. So frequently asked questions. A common one is, where do our residents end up after graduation? Well, if you look at our current faculty, 4 out of the 5 faculty are actually graduates of our residency program, including myself as the program director. We have residents that have joined private practices locally. We have residents that have gone into fellowships, for example, sports medicine, palliative care, OB and geriatrics. We have residents that are practicing in other states, for example, Georgia, New York, Boston, Texas, just to name a few of the recent states where our residents are currently practicing. Some of our residents choose to be hospitalists and practice hospital-based medicine. And we also have residents that are going into academics, both within our program as well as other academic programs upon graduation. So where should you live? There are lots of housing options in the Rochester area. There are housing options across the street from the hospital, which are relatively inexpensive. Our residents will give you a better idea when you have discussions with them of their housing options and how they chose where they're currently living. So are our residents happy? Well, I'm going to let you talk to our residents about that as well. We certainly try to provide an environment that creates a happy environment. We focus on wellness, and our resident well-being is extremely important to us. But you'll be able to have a chance to talk to our residents about that as well. So what will your interview day look like? Well, first you're going to have an introduction to the faculty and residents. There will be a virtual tour of the hospital. It'll include the resident lounge, the regular medical floor, the ICU, the inpatient rehab unit, labor and delivery, and the clinic. You'll also have interviews that will consist of 3 faculty interviews and 1 resident interview. And then in the end, we'll have time for questions. So again, welcome to our program, and I'm so happy you applied. And we'd like to provide you with all the needed resources and the information needed so that you can make an informed decision. And again, welcome to the Wayne State University Family Medicine Residency Program.